Good morning. Good morning. Welcome to the State of Mind Mental Health Conference. Thank you guys for joining us virtually on our Facebook page. Please share. We have a lot of important educational information that we want to share with as many as possible. So, again, thank you for joining us this morning. We hope that we are able to give you information to help you or someone you may know who may be suffering with a mental illness so that they can get that information as well. We have great panelists for you today, some of the best in the industry. They're going to be sharing a lot of information for you. So make sure that you get a pencil, pad, pen, whatever, your computer, whatever you need, so you can take down the notes and hopefully it helps you. We're going to go ahead and get started. Let me introduce our guests and panelists today. They are the top of the top. So I'm going to allow them to introduce and just kind of give you a little bit about who they are, their background, and we'll go from there. So immediately to my left is one of the best, great woman, Dr. Angela Jones. Good morning.
Good morning.
How are you?
I'm good.
Good. As you can see, Dr. Jones is with child, so we're going to take it easy on her today. And immediately to Dr. Jones's left, we have Dr. Daniel DeBro. How are you, doctor?
Doing great. Good
Good.
morning.
Thank you so much for being here. And then we have to the far left, Dr. Troy A. Moore. He is one of our educational liaisons for our board, A Better Day Foundation. He's going to be sharing with us as well. So here's what's going on. We wanted to give as much as we could. This weekend we actually had designated to be our mental health weekend. But because of the pandemic, we've had to modify a lot of things. Last night we were scheduled to do our fundraising gala, but that didn't take place because we were more concerned about spreading COVID and the new Delta variant and the influx of cases there. We wanted to be more safe than sorry. So we canceled that and postponed it, hopefully for next year. But because this would have been our third year, I believe, that we've canceled the entire event, we wanted to still do this portion, which is to give the information and to give the resources so that people can still have something from this. So that's the reason for us gathering today and doing it virtually and live because we didn't want to cancel it. And we know everything has switched to virtual and Zoom and all of that, but we wanted to still be able to do it to where we can still just make it interesting, make it fun, make it informational, educational, and not bore you to death. Because the information may be a little bit overwhelming, but we still want to make sure that we give you at least something so that you can take it and allow yourselves to, to do what you need to do with it or help those that you may know that are suffering with a mental illness. So that's it for me. We're going to go ahead and get started. Dr. Angela, I'm going to turn it over to you and allow you to do what you do. And we'll follow up with questions and answers after your presentation. We have a board member who's monitoring the questions online, so she'll give us the questions afterwards, and then we'll go ahead and feed it to you, and you can just, talk to whomever it is has questions for your presentation.
No problem.
Without further ado, Dr. Angela Jones.
Hello. So I will be referring to my phone a little bit because I had notes on there. But they told me that they wanted me to focus on mental illness and how it impacts relationships, your personal relationships, family relationships. I'm a licensed counselor. I'm also a certified sex therapist, so I see a lot of families, marriages, couples. So this is kind of my area. So, and I know that we're going to have other people on the panel that will focus a lot more on different areas of mental illness. So I'm just going to only focus really on relationships. Okay. And the thing is that when we are dealing with mental illness and we're dealing with relationships, it's a very, very complex situation. Because a lot of us, honestly, we have an idea of what we think a mental illness is, but we really don't know what it actually looks like for the people that are in our lives and our loved ones. We have social media, TV, movies that show us what depression, anxiety, bipolar disorder looks like. But when you look at someone that you are in love with or someone that you are related to, you're like, that it doesn't really quite fit. And it's usually really confusing because you don't want to put that type of label on someone in your family, but you usually know when something is wrong. And I usually tell people you need to follow your gut. If something doesn't feel right when it comes to a family member, there's a possibility something is not right. Right now, especially with the pandemic that just happened, there has been a huge influx, especially in my practice, of people who are realizing they're having increased anxiety and increased depression. Those are the two things right now that I'm seeing rampant right now. That really came into fruition last year. People being isolated, people being at home, people not being able to socialize, and they probably didn't realize how big of an impact not being able to do that had on their lives. So when it comes to mental illness, you can't just, I can't, but I wouldn't really suggest you go to someone you love and just be like, you know what, I think you have anxiety, or I think you have depression, because they're not really gonna listen to that. They're gonna be like, okay, down. They're probably gonna shut down. But the thing is, they probably feel it, but a lot of people don't want to put that type of label on themselves. So usually the best thing to do is just talk to someone, because there's a lot of people who are resistant to getting treatment, to getting help. Especially in the African American community, treatment is something that, it's like, okay, I have to, my arm has to be falling off for me to try to get some help. We grew up, especially in my community, we grew up thinking that, all your problems have to stay at home. Anything that you need, you could get from your family. And if you have a problem, you go to the church. Okay. And the church is a place of refuge. And I'm so happy that a lot of churches are opening the idea of being more than just a place of spiritual growth. They're realizing, okay, we need more resources than that. But you need more than just going to the church. You need more than just going to your pastor. You need more than that. You have, just like if you broke your arm or you broke your leg, you wouldn't go to the church. You would go to the hospital.
At least you shouldn't go to the church.
Right. You shouldn't go to the church. Unless there is a medical clinic or a hospital there.
Right.
Don't go there. And it's the same thing when it comes to mental illness. When you are not feeling at your best, you're feeling low, you're in the dark place. You could be suicidal, you could be homicidal, or you just are not being productive in life. Seek professional help. Seek professional help. Counseling. There's a lot of community programs out there, or statewide or countywide programs that can help people with low income. I used to work for the Harris Center, okay, which formerly was MHMRA. And those are for, you go there to get not only treatment for mental health, you get medication. You can get help getting resources in the community to help you with your Medicaid, Medicare, Social Security, all that, So there are many places, especially in Houston, that you can go to get help. But as a family member, how do you influence, or how do you push someone to get that help? Right. And I know this is going to sound corny and probably a meme that you've probably seen on Facebook, but you do it with love. You have to do it with love. You have to do it with patience as well.
So what does that love look like for the people who are suffering, or have family members who are suffering and they're just afraid to approach them? Like what would you tell them to do in that very lovable approach?
You usually want to make people feel like they're in control of what's happening in their life. And usually, this is my personal suggestion, is you just ask them what they need. If they don't need anything, be in their presence. Even though we're not really talking about grieving, when it comes to grieving, people don't know what they need, but people need people around them. Absolutely. So if you had someone that lost a family member or anything devastating like that, asking them, hey, what do you need me to do, is not likely the best thing to do, because they don't know. But your presence, you being there when they need you, or just being a shoulder to lean on, is very, very important. So being there, being attentive to their needs, right? They're probably going to be resistant to even that. They're probably going to shut the door if they're depressed, want to sleep all day. Even encouraging them to just get out, or inviting them to do different things. The thing is, you have to build trust, even though you feel like, well, you should trust me, I'm your family member. You want to feel like they can trust you to confide in you.
So give us the balance. I'll give you an example. So you have a person who's just at heart. Their natural born instinct is to help everybody. And then they have someone in their life who is suffering with the mental illness, and they're trying to be there for them like you're suggesting, and be there as a shoulder to cry on and all of that. When do you fall back and say, okay, wait, this is just too much for me to be able to deal with? Like they're coming on me now, and I'm starting to feel the same way that they're feeling. Like what is your advice to that individual who maybe just naturally, that's just who he is at heart, who he or she is at heart, is just to always want to be there and help everybody, but then they just can't seem to find that balance to back off so that it doesn't start to really affect them?
It is a hard balance, because when you are an empathetic person and you want to give, you tend to sometimes give too much. And their mental illness, I don't want to say will rub off on you, but it can affect your mental state as well.
Right, because it's not known to be contagious.
Right. No, right. It's not contagious. It's not contagious whatsoever. So don't worry. You don't have to worry about touching anybody. But what it does is, when you're dealing with someone with depression, that's not a light thing to help someone with. Right. It can start making you question your capabilities. It can make you start feeling down. It can make you start not being as productive on a day-to-day basis.
Absolutely.
So I'm always telling people, if you're noticing that your daily functioning is declining, then you need to probably reevaluate what you're doing in your life as well.
That's good.
When you're dealing with someone with mental illness, you can get sucked into it. And it's not like they're doing it on purpose. It's just something that just happens, and it can destroy relationships, especially romantic relationships. You want to be there for them, but unfortunately, if you take on so much, you become a caregiver.
So would you suggest, if it is a husband, wife, or whatever, do you suggest that one partner leaves if the other one is having that negative impact?
I'm not saying that, but what I'm saying is, if you are going to help someone else, you need to be getting help yourself. Okay. Right? So I highly suggest, yes, you're helping them. You want them to go to counseling. You want them to get treatment. I highly suggest that the person who is helping or taking on this caregiver role get counseling as well. It's just like with Alcoholics Anonymous. They have the support group of Al-Anon, for people who are dealing with alcoholics, because you need help and you need support as well, because it's not an easy feat. So make sure you put in place your support system as well as helping them get their support system in place, because it will cause problems.
So do you recommend for your clients, do you recommend for them to do the couple counseling and individual counseling as well?
If possible. Unfortunately, when it comes to counseling or therapy, some people don't take insurance, right? I don't take insurance, and that's a whole nother conversation. But there are a lot of people who take insurance. If you're on Medicaid and Medicare, like I said, there are programs out there that will take that to help you get some kind of counseling or some kind of rehabilitation service to help with that. Okay. But just make sure, as a helper, as a caregiver, you cannot be caring without getting cared for. That's usually the big rule of thumb.
That's good. I see a lot of people, married couples, whatnot, all of that. I see a lot of them suffer in silence, if you will, because they are either afraid of that partner and confronting them and dealing with the root of the issues. B, they are just immune to it. They've been dealing with it so long it doesn't even faze them anymore. Right. And I'm looking HEB, see a couple. You can tell that they're not the best of friends. But they try it. At least it appears that they try. They're holding hands, of course, walking down the aisle side by side. They're in my way, so I'm like, okay, let me just stand here and let them pass. So they just stood there. He's looking at her as she's trying to make a selection, and he's telling her to hurry up and all that. Just talking bad to her, if you will. And I'm like, okay, this doesn't seem right. So I ended up seeing them again in another aisle. And now it looks like whatever happened escalated, because now they're kind of arguing, but trying to be silent and discreet. But you can still tell that there's a problem. Right. So I'm thinking to myself, okay, something must be going on at home, that they're just not dealing with it, and they're just bringing it into HEB or wherever else they go.
HEB.
Yeah, not my HEB. But wherever they go, they're just bringing it, and it's just rolling over and rolling over, boiling up. So if you have couples that are watching and dealing with that, if you know someone like that, what are you telling them to do? Because for me, if I was in that situation, I would leave. I'm just being honest. I would pack up and leave, because me knowing me, it's going to escalate and become something that shouldn't be.
Right.
So I'm thinking, okay, I need to leave because we just not working out right now. You're not willing to get that help, and I can't help you anymore. I need to back away. So do you think that that's a good idea for people to separate from one another so that they can deal with
It's
those
easier
issues?
said than done, right? We're talking about some people that are married, like people that have been married for a long time. You have a commitment. You're in a space where you have to at least try. So I tell people, like, if you're noticing that things in your relationship are kind of starting to ripple up, you want to get counseling when things are at a simmer and not a boil.
So let's talk about the trying part. So is that like on a time frame basis? Are you saying, okay, you all should try for 6 months or a year or 2 years?
No, I don't usually give time frames
Okay.
because each couple is different. And then what you usually find out is that if they come in and they talk, the initial issue is not the issue. There's usually so much more and other underlying. Even
Right.
with people that are dealing with mental illness, it didn't just pop up out of nowhere. You'll realize that there was things brewing, right? And then what makes it even harder is that some mental illnesses don't really show, and I'm putting that in air quotes, show until you're older, right? There's some people who are bipolar disorder, schizophrenic disorder. They could be in like their 20s and something happens and then it really starts manifesting at that time. I actually have a good friend who is dealing with that right now. Like she's older and it's starting to manifest in her life and she never really dealt with that before. So it's like you're adjusting to not only having this but understanding like why is this happening to me? And there's a lot of things out there that tell you about mental illness, but when somebody says what's wrong, your first place is not like, okay, well, let me Google this diagnosis. So that's why it's always good to get professional help, and they can tell you like which direction to go to. Now, if you're in a relationship and you're not married, yes,
Booed up.
you're booed up. Yes, you have more freedom to move around. Like you're right, you don't have to deal with this. I don't have to deal with this hostility. I don't have to do that. But I still say if you do love someone, you want to at least try, but you don't want to try at your own detriment.
Yeah, that like you said, that's always the hard balance. Like when am I, not supposed to be here anymore? Or how long should I give this? How long should I stick around? How long should I hope that things get better before actually leaving? That is the hard balance. And I know there's many who, struggle with that. Even if you're not married, you do love that person with all your heart, but you just know that it's not getting any better.
Right. I mean, there are certain things that you don't wait. I mean, physical abuse, emotional, abuse, period. You don't really want to stick around to see how that's going to go. I mean, I would say, look at the red flags, protect yourself. Again, it's the thing of looking at yourself and seeing how much it's affecting you.
So is that still, let me see how can I word it, because I want to make sure I'm speaking for the people there, unless we have questions, Letitia. How do you know that if you are experiencing that abuse, how do you know that that would be the exact point in time to leave, or should you still try to help them to minimize that level of abuse?
That's tricky. I don't even want to really directly answer that question because I don't want to put anybody in a situation where they're like, well, she said, you should try, and
Right.
it's really abusive. I just usually, you need to listen.
But you get the question, though.
Yeah, you just need to really listen to yourself. If someone's having a bad day and maybe they snap at you, okay, they're having a bad day, they just snapped at you, but is someone having a bad day and they throw a lamp at your face, that's something different.
Yeah. That's
So
criminal.
I don't want to tell anybody that there's a certain time or a time frame that you should wait or before you actually leave. I tell people you need to always listen to yourself. Intuition is real. You know when things are not right.
Right.
And if you can see that things are going to get worse, it's best to exit as soon as you can. Now, if you're in a situation where the abuse has gone so far, then of course, then you need to prepare to leave and try to make a plan to leave, because marriage is, you have to deal with the divorce part too. Right. But when it comes to mental illness, like I said, it's difficult because someone is diagnosed with a sickness, and a lot of it, like they say, it's not their fault, but it is still in their control to get help. Now, will it just go away with help? Probably not. Right. But consistent help, medication, if that is what is needed, counseling, you want to see someone trying. But there's not like a certain time frame in regards to that.
You know, we see a lot of people, married couples particularly, the woman is being abused, most likely. We often, I mean, not often do we see the man being abused by the woman, but I mean, it does exist, but it's just not as popular as the roles reversing. One of the things that the foundation wants to do, and what we've been working on, is partnering with different organizations that offer that help and resource. I'll give you a case. So there's a married woman who's been with her husband 15 something years. Things kind of worsened during the pandemic because, of course, he lost his job and finances were becoming a big struggle. Anger, everything just escalated to the point to where it became physical. She attempted to leave at the first, sign that she saw that it was, okay, this is getting bad, I need to leave. She attempted to leave, go stay with family. He followed her, went through that whole thing. Get her to come back home, told her that she wasn't leaving and all of that. It just became a big, nasty thing. She tried to leave town. He followed her out of town because, most of these phones now, they got the tracking thing on the phone. He was able to track her phone and see where her location was, tracked her to where she was. She was at a woman's shelter in another state. But the way that their state is set up, she was only able to stay there 3 or 4 days before she had to leave, and she didn't have anywhere else to go, didn't have any money to go anywhere. And when we heard that story, I'm thinking, like, this is what we're here for. This is what we need to be working on to help fix and change. And so I sent the message to our congressperson, Lizzie Fletcher, and just kind of gave her the story on what's going on. And like, is Congress working on anything to help individuals in this situation? Of course, the answer was very washed down, and this is stuff. Some legislation is being proposed and all of that. I'm like, but this has been going on for a while. Like, why hasn't anything changed and improved? So, we're going back and forth on that regards. I'm saying, well, there's an individual that we know who reached out to us for help, and we've partnered her with several different organizations that have all turned her down. She couldn't go stay at the women's shelter. Montrose Center was full. The other one downtown was full. She didn't have anywhere else to go, and she knew if she went and stayed with a family member, he would know and he would find her because they've been married so long. He knows the whole family, so he knows where to go. So one of the things that the foundation, the Better Day Foundation, has been working on and trying to do is be able to offer the resources to help women, men, whomever, that are victims of domestic abuse, give them the resources so that they can go get the help that they need, be safe, feel protected, feel safe, and be able to move on with life, because we don't want it to turn out to where we see on the news that, she was killed or whatever at the hands of her husband because he was just too far gone, mentally illness, wasn't dealt with appropriately. But as you were speaking, I'm thinking of this situation, like the resources are not there. So even if you have a woman who's ready to leave and she's tired, she's done, and she tries to leave, law enforcement is not going to help her because they have limited resources and they're just frankly not wanting to deal with it. Two, she doesn't have anything to do or anywhere to go on her own. And the public assistance isn't there. The state assistance isn't there. So if you know of a program or a foundation organization that specifically deals with that type of abuse, please let us know. And you can even mention it now so that we can give, again, all of the information to people so that they can have it. And hopefully it helps someone along the way.
A lot of the organizations that you listed are the ones I would have said, so it is unfortunate. But I know during the pandemic, there was an influx of people that needed help.
Absolutely.
You were basically sheltered in with your abuser. That's why I tell people, if you can, try to research as much as you can before you leave. Try to prepare, because I know Greyhound has a program where you can actually tell them what's going on and they will send you somewhere out of town. Because if, like, say Harris County is full, as you were dealing with, they will bring you somewhere. Or there are other different transportation companies that will partner with you to do that. So I know what you're talking about, especially in the last year. There was just a huge influx. People had nowhere else to go. People had to shelter in place. People had to basically suffer even more because they were sheltered in place with someone either they were abused by or eventually it started to get abusive. Your support system is very important. So if you're unable to research on your own because there even may be restrictions in regards to what you do on your phone or what you do on the internet, trying to have your family help you with those resources. But if I do have any other resources I can give you, I will give it to you. So maybe you could post on your page.
Absolutely.
Yeah.
Absolutely.
But when it comes to abuse, which is a whole nother gambit and a whole nother conversation, it's money. Money usually is what limits people from getting the help.
Absolutely.
If you are someone who is affluent, has money for themselves, and you leave, you have more resources, unfortunately. But unfortunately, like you were saying, most people do not.
Right.
And knowing where to go, other than the usual, the women's shelter and stuff like that, is going to be very important. So
Yeah, that's something we deal with daily. I'm on the phone, emailing Congress people all day. Really, I mean, it's a fight. It's
And
really a fight.
I also want to mention that the reason you don't see as many men is because there's still a stigma of men getting abused. They don't really come to get help.
Right.
And
Yeah.
so there are many men who are actually out there getting abused, getting manipulated, getting all that stuff, but they don't feel safe going out to seek help, or they don't even, it's not like they have a men's shelter.
That's true. That's true.
So even though the resource, it may be less need, it doesn't mean that they're not out there. And due to the fact that they're not out there, they usually are stuck in horrible situations as well.
Yeah, I mean, we've seen it too. I've seen men be the abusee, and I guess they just don't know what to do.
They don't know what to do, and they also don't know where to go. So for as hard as it was for you to find a woman into a place of care, imagine how much harder it is for a man, right? And being that I did work for the county, I've seen men with children try to leave with their child, and they had nowhere to go because there's no shelters that have a men's shelter where there's kids. There's women's shelters for kids, but not men. So it is difficult, and the resources are very low. You would think that a metropolitan city like Houston would have it, but as you can see, you can drive in downtown, and you can look under the freeway, and there's tent cities.
Yes, exactly.
And that's not only because they want to be there, but it's also because the shelters get full. They don't have a place to go. It's not really, so that's a pandemic in itself.
We do what's called Feed the Community. We were doing it every fourth Saturday of every month, and many of them, Dr. Troy can tell you, many of them have a mental illness, and it's so. I mean, it breaks your heart because they're dealing with homelessness, and then on top of that, they have to deal with this mental illness too, and they have nowhere to go. And I mean, we're just like, wow. But I mean, it just gives us the fuel that we need to continue going and continue pushing and making sure that we at least try to be able to offer the assistance that we need. And even if we can't give them their exact medication and whatnot, just being there for them to talk to. I think many of them just want somebody to talk to and hear what they have to say, how they feel, and all of that. And it makes a big difference because they became familiar with us. They knew us. They knew the foundation. They complimented us on the name and the T-shirts and all of that. They just wanted somebody there to talk to. But we knew, when we left, like, I hope that they don't go and do something crazy. I hope that they don't get into a fight and all of that. So I understand what you're saying.
Right. You have to remember the hierarchy of needs. When you're dealing with a homeless population, yes, they need mental illness, but that is not on their hierarchy of needs. They want to be fed, they want to be clothed, and they want a place to sleep. And if you don't have those needs met, the mental illness aspect of it is not going to be priority. So if I don't have something to eat, I'm not really worried about if I got my medication or if I have a doctor's appointment.
Right.
I'm looking for something to eat. And that's usually also the barrier too, because you're trying to find them food, you're trying to find them shelter, but really, like, if you dealt with your mental illness, things may be a little bit easier.
No, it's
but
true.
How am I going to get to my doctor's appointment unless they give me a voucher on the bus? How am I going to get my medication if it's not totally free? How am I going to make sure I keep my medication? Because a lot of those medications, I mean, you can be homeless there, you steal them. It's a cyclical process out there, because I was working with the homeless population before, and I know it's continuous. And as a counselor, when I would go out there and talk to homeless clients, the first thing I would do is I would go get some food, then I would go talk. Like, I would bring food first, because they're not going to listen to me if they're hungry. They're just not.
That's true. That's absolutely true.
So I bring them something to eat, and then I talk to them.
Right.
So
sweeten the deal.
yeah. So as you can hear, there's just so many variations in regards to relationships, the type of relationships and mental illness. There's not one answer for any of it, right?
I got you.
And when it comes to relationships, if you are dealing with someone that is dealing with a mental illness, help as much as you can, but you have to make sure you get help as well.
I agree. So the last thing we want to touch on, Dr. Angela, because this is your area and this is going to be a little bit adult, so make sure the children are, not around for this portion.
Right.
So we want to talk about how mental illness affects those in the bedroom. How do you deal with that? What type of medication or therapy? What do you offer for that particular issue?
So in the bedroom, actually, it's the medication that can affect you in the bedroom, and this.
So not the mental illness itself.
Not that I'm fully no. I mean, you can have an erection. You can still get aroused, even if you are hallucinating, even if you are having a manic or a depressive episode. When you're depressed, you may not have the desire as much. Right. So I just want to put that out there. But
okay, good.
Unfortunately, it's another like this or that situation. For example, with the anxiety increasing the way it did in the last year, a lot of people were considering taking medication. Okay, great. But unfortunately, a lot of men will take the medication and they will have problems with being competent in the bedroom.
Right.
Or they'll get to a good place and then bloop, it was down. And they're like 25 years old, 30 years. So it's not like.
So they couldn't mix it with the Viagra and the Cialis and all that.
No, well, the thing is, you're 25, 27, 32.
Oh, wow.
Who's going to prescribe you Viagra? But it's just not a good mix. But the thing is, it's like you have to ask yourself at that time, what are they going to pick?
Yeah.
So they stop taking their medication.
Of course.
When you're depressed, it doesn't even matter what the medication. You just don't have the desire, right? You don't have the desire to be touched. You don't have the desire. You don't feel desirable. You don't even have the energy to even think of, like, even the thought of it is like, okay, please. So unfortunately, when it comes to the bedroom, getting a good doctor that understands the medications. If you take something that's not working, just remember, don't quit right there. You need to go back to your doctor, tell them what's happening, and maybe they can try to prescribe you something else.
Okay.
You have to remember, just even with headache medicine, we have Advil, Tylenol, ibuprofen, Elite, like all these different kinds of medications. If it was only one medication that was needed for headaches, then we will only have one choice.
Right.
But Tylenol may work for me. It may not work for you.
Right.
Advil may work for you. So you have to try other things. Make sure you trust your provider.
Sense. Yeah, that makes sense.
Hey, you gave me Zoloft, and this is really, these are the effects that it's having on me. Is there anything else? And trust me, there's always something else.
Of course.
It gets frustrating for you because you start feeling like a guinea pig, but just know you're not a guinea pig. You're literally just making sure you're getting the right medication.
That's good. That's real good. I often think that when you see couples, if you see like one of them have a mental illness, is it that they're just angry because there's not any, activity at home, any sexual activity at home?
I think that's case by case basis. Honestly,
that's just what I think.
Yeah, it could be a case by case basis, but the anger doesn't only come from the environment. It just can be perception. It could be delusion. Depending on what they're diagnosed with. So,
gotcha. Thank you so much, Dr. Jones. Tisha, do we have any questions for Dr. Jones at this time? No? Okay, good. Dr. Angela, thank you so much for your insight. Dr. Daniel.
Yes, sir.
How are you?
Doing great. Glad to be here.
So we're going to go ahead and allow you to introduce yourself to our viewers, and you can go straight into your presentation.
Sounds good. Thank you. So I'm Daniel DeBrule. I'm a clinical psychologist, and a lot of my time early on, I am originally from North Carolina. I went to both UNC Chapel Hill, UNC Charlotte, and I had a really unique experience there at UNC Charlotte where I was able to teach in a private school which was predominantly African American, and our goal was to minimize the achievement gap, that often there are lower expectations for certain children in certain groups, and I'm sure Dr. Troy is well aware of this, and a lot of educators in the field. And it was definitely one of the most rewarding and experiences I had, but also one that really was kind of like my big break. So I really owe a lot to the principal there, Miss Lenoa Smith at the Thomason School in Charlotte, North Carolina. And really ever since then, I've had an interest in, thinking about the things I do in mental health from a lot of different lenses, and thinking about how, we can get to a lot of different groups. So I wanted to kind of also share that a lot of my focus over the 20 or so years I've been in the field in psychology has really revolved around two main areas, and they're both at the extreme side of things. So the presentation I'm going to give today is going to focus on mental health, and in particular, mental health in terms of the extreme one being crisis, and what to do if you feel like an individual is at risk for some type of behavioral event, or even on a far extreme suicide, but also on the other extreme of how people can deal with trauma, and often over time, if they're able to deal with trauma in a certain way, that they might experience something we call post-traumatic growth. And what does that look like? We hear all the time that when we have either individuals go through an abusive situation, or let's say it could be some type of other severe life-threatening trauma that people don't anticipate, we think often about the ways it affects them. And I'll talk about that and what is the difference between people, and the vast majority of us who might experience trauma and never develop PTSD, and those that do, but also over time how for the vast majority of people, many will report that they've grown in certain ways and experienced certain benefits. So this has really been the focus of mine since I came down to the New Orleans area for graduate school. I know near and dear to you and your home area, where I still do some work in the hospital setting. But there in private practice, I'm often working with CEOs and high-ranking professionals, and they're really looking to thrive and take their craft or their profession to the next level. So it's really rewarding that I get to work with some people in crisis at kind of their lowest point, and others seeking to reach some of their highest point in their career. I'll start with suicide, and the topic that I really do a lot of presentations on, because this is one that really is poorly understood in so many realms. And one of the many things I do, I have 2 appointments at the Baylor College of Medicine in psychiatry and medicine, but also have an appointment as faculty for the American Association of Suicidology's National Training Center. So one thing we're really looking to do, and I'm privileged to be here today, is to spread the word on what suicide looks like in the United States and how we can prevent it. And I'm just going to go ahead and give one spoiler alert that one of the best methods that we have, one of the best resources we have to prevent suicide, is the National Suicide Prevention Lifeline, and this is 1-800-273-TALK, or 1-800-273-8255. This is something that, as Dr. Angela was just mentioning, sometimes it might take a third party who's concerned, and it can be the person themselves, it can be a third party, it can be a friend, a parent, anyone. And so, we were just mentioning sometimes we might have awful events in the community that involve either a high schooler or a young adult. Doesn't matter what age range this person is at, and that resource is available 24 hours a day, 7 days a week. It's also the National Veterans Crisis Line. People just have to press 1 to get to that routing for kind of some more special programs for that. So, the question becomes, what does suicide look like in our country? What are the rates? So, suicide is a top 10 leading cause of death. It actually ranks 10th in terms of causes of death. We lose around 47,000 Americans each year to suicide. There's one suicide every 11 minutes in the United States, and about 130 per day. The interesting thing, though, that we're seeing for the first time in many years is that the suicide rate actually has decreased from 2018 into 2019 and from 2019 into 2020. We've never really seen this. I've been studying these suicide rates for about 15 years now, and we've never seen this before. So one thing we do know is what we're doing is working. And in particular, even with the veteran population, which is a group I've focused on in my career, we've actually seen a 7% decrease and veteran suicides, which is just remarkable. I mean, to see a 1 to 2% decrease is really substantial, but a 7% decrease is really amazing. And a lot of people thought with the pandemic, those rates would skyrocket. Those
Right.
rates would increase. We've even had, won't name any names, even certain politicians, talking about how bad the suicide rate's going to be because of the pandemic. The data has not borne that out. In fact, the rates tended to get a little bit lower.
So I've seen a few reports where they indicated that the suicide rate had increased during the pandemic, especially for teens and young adults. So is that information inaccurate?
That's one of my key points I wanted to make, that when we break down certain groups in terms of suicide rate, so the overall national rate is about 14.7, and that's per 100,000 people. So one thing that we do know is it's a really low base rate. It's a really, we have hundreds of millions of people in the United States, and we lose 47,000. And, every life is valuable. Every life is precious. But, when you think about that 14.7, what it looks like for, let's say, Caucasian men, it's about 26.1. What it looks like for non-Caucasian men is about 12 to 13. And then it gets lower for Caucasian women, but the lowest group of all are non-Caucasian women. And in particular, when we look and break down the ethnic patterns of suicide rates, the lowest group year after year after year are African American women. And I think that points to a lot of things. What is it that African American women are doing well in terms of coping, in terms of some of the best things that we know are protective factors against suicide: connecting with others, having some type of spiritual or religious practice, and being able to rely on that.
Absolutely.
And sometimes, and I've heard this from psychologist colleagues of mine, and sometimes trainees, just a I don't want to say pressure, but an expectation to just be a strong and proud woman and those kind of contexts. So again, it's really fascinating that we see those rates. However, one thing that was true, and this is from data presented recently by a good friend of mine, Dr. Thomas Joyner, who's one of the top people in our field.
Tom Joyner?
Mm-hmm.
The disc jockey?
Not him.
Oh.
Different one. A little bit taller, this guy. But he said that in Maryland in particular, they did a breakdown. And while, the rates went down for most groups, and this is where, because the rates are so low for African Americans, sometimes where we see certain peaks and valleys in that particular group, it gets buried in terms of the larger statistics. So in the state of Maryland in particular, lower rates overall. However, for African Americans, and there were some increases in the state of Maryland. And when we look at certain age groups, the age group that tends to be higher and has had a few increases is the 15 to 24-year-old cohort. So we are seeing some peaks in certain areas, so something to still be concerned about. And, I want to just point out, too, that, professional help is always excellent when you can access it. But, as we've learned already, sometimes the barriers can be significant. And this is where, again, I've worked on some projects through National Institutes of Mental Health, where we're looking to find ways to work hand in hand with faith-based communities and getting really effective suicide prevention messaging and assistance. And, sadly, there's a lot of cases. I'm going to just share a quote from an African-American veteran. And he had said, I went to my pastor. I was really dealing with a lot of thoughts about the things I went through in Vietnam and what I should do with myself and should I even be here. And my pastor said to give it to God. And the veteran said, unfortunately, God gives it right back to me. So it really calls into mind how we can kind of work hand in hand. That, for example, if an individual is going through a tough spot, let's say they're going through a life change, they just moved to a new area, or had a significant loss, pastoral counseling is excellent. And again, I understand, I think in a lot of ways, what predicts good outcome in therapy is a relationship between the therapist and the client. Doesn't matter, it could be, someone in the private sector, it could be someone at their EAP, at their job, it could be the priest, it could be the pastor, it could be a lot of different individuals. And I can't underscore enough how vital and important that is. But I also want to add to that, that when it comes to the really extreme situations, such as a person having suicidality, and let's say on the far end of the extremes, maybe even command hallucinations, maybe even psychotic symptoms, that's something that really requires medical intervention. The pastoral counseling can definitely complement that and support it. And, this is why, again, maybe sometimes this is the route that the individual goes to their church, and then it's at the church that someone working with them suggests, hey, maybe there's some other ways we can approach this. Maybe we can get you in to see, someone in the medical community, or, think about, other forms of treatment, even intensive outpatient. And that's something a lot of people don't understand either, the many areas of treatment they can go to.
Well, in my experience, Dr. Daniel, a lot of churches, especially those mega churches, they're not equipped to handle any type of mental illness or mental counseling and any of those things. Pastoral counseling is completely different from crisis counseling and all of the other breakdowns, right? So you were pointing that out, and I think that's kind of the crutch, if you will, that we've been using, especially for African Americans, is just to take everything to God and take everything to the pastor or whatever. And that's not necessarily dealing with the root issue. Mm-hmm. If your pastor is not equipped to handle that, and they haven't had counseling, schooling on how to deal with it, taking it to God is going to be their best answer. That's the best you're going to get from them, because they don't know how else to deal with it. But churches like St. John here and St. John's downtown with Pastor Rudy, they offer that type of assistance through the Bread of Life Foundation, where they partner a lot of the homeless, many of the homeless. They deal with the homeless on so many different aspects. So I agree with you. It is important to take it to the church, because the church can be that bridge to help you take it to the next resource, right, to get you that exact help. But if you're dealing with a church, especially a big church, where they have nobody on staff that's trained in that area, and the best they can give you is to take it to God, then that's a clear sign, okay, this might not work too well for me. I need to actually go and see a professional to help me deal with, whatever the issue is.
Yeah, absolutely. Well said. And, there's so much variability, as you alluded to, in terms of, different places of worship and the types of staff they have and the training the staff can have. So, again, it's something always worth, looking into and researching and, maybe just feeling out, and this is another area where the family might be able to really be valuable as well, that they can kind of help, direct the person who's dealing with some kind of crisis. Maybe they can go here, maybe they can go there. I want to skip ahead, and again, by mentioning that, just to kind of round out this section and lead into one on the post-traumatic growth side of things, to kind of bring us to a more redeeming value of what mental illness can look like, and in terms of there actually being many potential benefits, surprisingly, to the people's struggle through mental illness and sometimes facing certain forms of trauma in a lot of different areas. I want to emphasize again the National Suicide Prevention Lifeline, 1-800-273-TALK. But what a lot of people are looking through in these suicidal moments are aspects of hope. One of the other solid interventions we use is a hope box. It can literally be like a shoe box or an Amazon box that people put in all kinds of pictures, or it could be things that give them a sense of pride, things that give them a sense of happiness. Maybe it's places they're looking forward to traveling to. Maybe it's pictures of their family, just something they can refer to. And this is available even on an app. We have a virtual hope box that people can go to, which is a really good resource. The other resource I wanted to mention is a safety plan. And so a safety plan is something that an individual can do on their own. It's best if a clinician guides them in this process. And they basically mention a few different steps. What tends to happen, what are the conditions or things I notice when I get suicidal? What are some things I can do on my own to help offset that? Maybe it's going on a walk, reading a book, spending time with their dog, just whatever it is they'd like for hobbies, and playing music, singing, things like that. Step 3 is what the person can do for distraction, whether or not that's, friends they can call that just kind of keep the mood light, and visiting places like Herman Park or Memorial or whatnot, just to kind of get away from it all. And step 4, people they can call for a heart-to-heart discussion. Step 5 are professional resources they can use if they do have a therapist. And then step 6 is ways they can make their environment safe. And I do want to emphasize too that one of the best things a family member can do if they feel like they have a teenager, young adult, anyone at any age who might be potentially in a suicidal crisis, either at that moment or in the near future, is remove as many lethal means in the home as possible. Firearms are at the top of the list. overstocked medications, poisons, blades, you name it, just any kind of major means. And this isn't an argument about when it comes to firearms, which is by far. We look at the percentages. Firearms take about 60% of suicides when it comes to men and about 1/3 for women. So that's really one of the most powerful things we can do. Not an argument about right to bear arms. In fact, we want to honor that and respect it. However, most people, if they're thinking clearly, would not want access to those if they're being in a crisis and they're in a really bad spot. So maybe just for a couple weeks, give them to a friend, give them to a family member, something. Remove the ammunition or use a gun lock, use a gun safe, things like that. Now, the second section I wanted to present briefly is, the experience of trauma and how this can definitely affect certain groups more than others. And, for so many reasons, I think, especially here in the past couple of years, many are experiencing vicarious trauma. It can be heartbreaking to watch some of the videos that we've seen, of seeing, young men, in a lot of cases, African-American men, lose their lives in different ways. And the fact that, this experience, we know can affect certain groups more than others. And just off the top, we also know that women tend to be suffer trauma at somewhat higher rates than men in general, just based on things like sexual assault, which is, somewhat common. So the first thing to look for when some people are thinking that if I've suffered a trauma, what does PTSD look like and how might that affect me? And when we are evaluating this in a clinical context, we look for a few major things. One is that if there's been any re-experiencing. So if the person is having nightmares, intrusive thoughts, feeling like the event's happening again, that's really one of the hallmark symptoms. Because some of the other ones, like avoiding the locations and avoiding the people, feeling a little bit emotionally numb, isolation, feeling on edge, those can look a lot like just general depression or anxiety. One of the things that really kind of tells us PTSD and teases it from depression, anxiety, are those re-experiencing symptoms. But one thing to note is that people may often have these briefly after they survive a trauma. In many cases, it may dissipate over time. And then in other cases, PTSD might not affect the person for several months right after the trauma, but it has a delayed onset. Maybe it's a year or two later. Maybe it's 10 years later that they start to feel a flood of these symptoms.
So two things I wanted you to kind of break down and help us understand. So give an example of what PTSD is and then how is it displayed so people can understand, because it can be misinterpreted if people don't really understand what it is. Absolutely.
And I think, sadly, I see in, some situations a bit of an overuse of PTSD. It's not, if you have like a financial loss because of a car accident without kind of injury, that's typically not PTSD. If you're going through a significant loss, like my grandfather was incredibly, important to me as well as my other grandparent, and losing them was really tough. But, we expect to lose our grandparents. That's not outside the realm of normal human experience. Now, if a parent loses a child, that's something we never anticipate we're going to do. Or if we lose a sibling and they're in their 20s, now that looks like, especially because in a lot of those cases, it's going to be something more traumatic, especially if it's something like homicide, something like that. So first of all, we have to tease apart if the event itself typically involves a threat to someone's life or their physical integrity. So here's where an assault that's not life-threatening, could be an example.
So is PTSD, I'm sorry to cut you off, is PTSD connected to mental illness?
Exactly. So PTSD is a form of mental illness that it tends to affect a pretty small percentage of the American population. We see that roughly about 1/3 of those who experience significant trauma will develop PTSD at some point. It's highly treatable. We used to categorize PTSD as one of the many anxiety disorders. We now, in the latest complexion of the DSM, which is kind of our textbook we use to diagnose mental illness, we see it as being something a little bit distinct, although it has a lot of similarities with the anxiety disorders. And typically people can be very on edge. For example, there's a lot of physiological studies where people see heart rates are higher than normal. We even see certain areas of the brain that when we do neuroanatomical studies can be a little bit lessened. So there has to be, or in a lot of cases, it seems like the brain is very overactive Often due to just a high rate. You think of that feeling you get when you hear and see a policeman behind your car. And that to have that kind of feeling and that sensation of being on edge and being at full
I'll be ready
arousal
to
mode.
die.
Exactly, and to have that over a long period of time, and sometimes for that to hit you, if you're at HEB just shopping for groceries at the broccoli bin, that's where things start to look a little bit more like
I'm more
PTSD.
of a green beans type person. Go ahead.
Okay, fair enough. And we also see again the nightmares, the intrusive thinking, the constant going back to the event. One of the hallmarks of PTSD is the person isn't able to be present. They're still locked into thinking a lot about a traumatic memory and having that kind of overwhelm their life. But then it can also affect other areas of their functioning as well, such as their job performance and the ways they interact with other people, maybe being a little bit quick-tempered and a little bit again kind of ready to ready for action and really difficult to relax and that sort of thing. Yeah, but what I also want to add to this is that PTSD is highly treatable. So the unfortunate part about PTSD is a trauma in and of itself. It's tough to talk about. It's tough to think about. It's tough to work with. And so if a person goes through a really rough trauma, they might try to share it with a friend or family member. But invariably, other people don't want to hear about something really invasive and really personal. So maybe they shut that down a little bit, or the feedback they give them is not what they need to hear. Working with clients in a clinical setting, we really just allow the person to freely and openly talk about that trauma. And some of these things can be really personal and really they might have levels of disgust or shame or you name it. And we really want the person to focus in on that event and talk about it in as much detail and in as much to where over time they become a little bit more comfortable with it, and it doesn't tend to just continue to pop up. And so there are several of these what we call empirically supported treatments, ESTs. This means these treatments work for most people most of the time. And they include cognitive processing therapy, prolonged exposure therapy, and even written exposure therapy. So people can even journal and write out the trauma that they've been through, in addition to sometimes talking to a therapist about it. This can also be done in a group setting. And this is what most people on the street would not really know about PTSD, that you can get treatment, and it's not like you go into therapy and you're in therapy for a year or two. Most of these treatments take 9, 10, 12 sessions. So this is where a person within a 3 to 4 month time frame, after maybe building some rapport with their therapist or counselor, and that they're able to do that. And again, I'm going to go back to the fact that we're really lucky here in the Houston area that we have so many available therapists from all kinds of different backgrounds, all kinds of ethnicities. So sometimes finding a good fit can be key, and finding there's some that might wonder, well, in order to really have a good experience in therapy, is it important for me to match up with someone who's about my same age, my same gender, or same ethnicity? And if that's what the person prefers, I would say go for it, to try to find it and see if that can work. But yet, I think you can also make an argument for example, if someone is going through and facing a trauma that has to do with the opposite gender, sometimes that can be productive too, to actually seek out a therapist of the opposite gender. So just like with couples work, and there's no one size fits all. And the other thing I'd really encourage folks to do is to really continue to, if they don't find that, they have a couple sessions with someone, a new therapist, and they just don't feel like they're on the same page, or they don't have a good working relationship, there's so many other therapists out there. Continue to search and seek and find someone that you can really gel with.
So I wanted to go back and touch on what you mentioned a few moments ago, and Dr. Angela, I want you to chime in on this as well. So when you did the breakdown of the different ethnicities and how mental illness affects them and all of that, I wanted to ask you, Dr. Angela, growing up, was that something that was discussed heavily in your household, mental illness and all of that? Because for me, it was no.
No. I am a first-generation American, and so mental illness was never brought up, like literally ever. So it was more like, get over it. and push through it. I didn't really hear about mental illness until it's actually part of the reason why I do what I do is when I took my first psychology class in high school. And I'm reading, and I'm like, "Oh, that sounds like my cousin, or that sounds like my mom," that's when I was actually first introduced to it was in school in like psychology 101, and so it wasn't anything that was even I didn't even know what a therapist did. Right. I didn't know any of that. In my community, it was either you were crazy or you weren't.
Exactly.
The end.
Exactly. So that's what I was getting at, Dr. Daniel. For us, it's just not discussed. We didn't know anything about it. And then when we would hear it on the news or whatever, so-and-so suffers from a mental illness, it was like, okay, what's that? And most likely they were going to either be Caucasian or Asian. It was just never connected to African Americans. And when you was talking about why the number is so low for African American women, I'm thinking more so because Big Mama just either didn't play that or she's not addressing it. Because I know for me and my family, there are some mental illness things there that go unnoticed, undealt with, and all of that. And hopefully I can help change that because I want to help people understand it doesn't mean that you're less of a person because you suffer from a mental illness or because you battle that thing every day. I'll give you my own personal story. Growing up, I was always hot-tempered, always quick, always mad, and all of that. Whether it was because my father wasn't around, whether I didn't, feel like I was appreciated, all of that. So it wasn't until 2015 I was living in the Woodlands. I had just moved to the Woodlands, Texas, and I was just in a deep, deep depression. And I didn't even realize what was going on. And I mean, of course, many Katrina survivors suffered all of that, PTSD, everything. But it was 10 years later that they finally say, okay, I think you're suffering from delayed PTSD. That's what the counselor told me, the therapist told me. And I'm like, okay. So that's when I was diagnosed with manic depression, bipolar disorder 1. And I mean, I cried like a baby. I'm like, what is that? So they had to calm me down and let me know, listen, you can still live a very successful life. You can still be effective in everything. It does not mean your life is over. And I'm like, okay. But in my mind, I'm thinking, how did that happen? Like, what is manic depression, bipolar disorder 1? Like, is that going to affect my children? Like, what happens when you're officially, and I think that's what scares everybody, is to get that official diagnosis. What happens now? So I had to go through that whole deal, going to therapy, just feeling so low, like, oh, I just hit the rock bottom. Like, what is going to happen now? I was embarrassed. I didn't tell anybody immediately. But eventually, maybe a year or so after being diagnosed, I finally told my mom. And she was looking like, okay, so what does that mean? Right. And I had to explain it to her the way it was explained to me. But I'm getting at it's just not discussed enough in a lot of households, in a lot of ethnicity groups. It's just not discussed. And I think, for foundations like, what we're doing, Dr. Angela's practice, all of that, when they see for us that you can still be a doctor, you can still be a business owner, you can still be a teacher, all of that, even being diagnosed with a mental disorder is not the end of the world, people. It is not the end of the world. So if you have not been diagnosed and you feel something is off, please go and seek professional counseling, therapy, so that you can get the proper diagnosis and then be able to deal with it accordingly. Dr. Troy, you wanted to chime in?
Well, interestingly, I was kind of thinking about what you were saying regarding how we perceive things in the minority community, specifically the African American community, the Hispanic community. It's almost like mental health is a joke. And that's kind of the mentality. And I'm saying that because if you think about it, if you grow up in an urban area and you see someone walking down the street talking to themselves, or you see somebody in the street dancing or whatever, and there's no music on or whatever, you say, oh, that's just Crazy Joe. Everybody knows Crazy Joe. Right. He's not going to do you nothing. He just, he's just crazy. And you just keep walking until Joe kills somebody.
Right.
And then, okay, now we're worried about Crazy Joe. What happened to Crazy Joe? He really clicked out today. He wasn't dancing today, yes. But nobody ever addressed it.
Right.
It's like it was just a joke. We had someone in my neighborhood growing up who we used to call crazy, and he walked out the house. He was talking to himself every day up and down the street, and we would make jokes about it.
Right. Because we didn't know.
Right, we didn't know.
know.
Until one day, he hit his mom. And then we were like, wait a minute. Like something is really wrong with him. And he wound up getting put out the house. But, because his mom wasn't taking that, because she was taking care of him. But the bottom line is it's time out for us in the minority community
To be ashamed.
to think it's a joke, to ignore it.
Absolutely.
I work in schools. I've been doing this for 24 years as an educator. And, broken kids wind up being broken adults. And many times I talk to parents, I talk to, family members, grandmas, aunts, uncles who are taking care of these kids, and they never really address the issue until something traumatic happens.
That's always the case.
Yeah, until something traumatic happens. So now, if I'm getting ready to put a kid out of school because I'm an administrator, here comes mom, and now she's telling me all of this stuff that's going on with the kid. Well, he's been at home, and he's been kicking holes in the wall, and he's, cussing out his grandmother, and he slapped his little sister, and he
done beat up the dog and everything.
Yeah, he
And
set
you
the
still don't
dog
think
on
nothing
fire.
wrong.
Yeah,
Oh
he
my
set
God.
he set the dog on fire. I literally had one like that. Oh my God. He set the dog on fire. So I'm sitting there and I'm saying, what kind of help are you getting for this child? What have you done? And many times it's like, well, we were just trying to talk to him about it and, say, hey, when you get to school, don't act up.
Oh, we went to talk to the pastor.
Right, yeah, you know what I'm saying? But now, even with today's generation of parents, I think the pastor in church really comes in with people like us, our generation. But with the younger generation of parents, many of them don't even have a spiritual side.
Absolutely.
Yeah.
So they don't even know to go to church. It's just like we're just kind of winging it.
Yeah, the pandemic killed all of that.
Yeah, right.
This virtual worship,
Yeah.
all of that. Yeah, that killed
Right.
that.
We're just kind of winging it. So the parents don't have relationships, positive relationships, sustaining relationships with people who can help. Therefore, their child gets nothing.
I think Dr. Daniel, he actually said it, like, as far as like African American women, it's what we call the superwoman complex. Like, we have to be everything for everybody.
Absolutely.
So killing myself or thinking about suicide or even attempting it, it's not even an option, because it's like everyone is dependent on me.
Right.
And what would happen
Yes.
if I'm not there?
Yes.
And so I he didn't say superwoman complex, but he did say that, like, we have to be everything for everybody. And then the history of African American women we just have to push through, like, just deal with it. Like, I don't feel like living, well, I just have to deal with it.
Because you're not a strong black woman if you don't.
Right. And then when we don't get help and we don't do anything, we're then labeled the angry black woman.
So you can't win for losing. You can't win for losing.
Right.
And interestingly, that you brought that up, I was just dealing with a parent this week who was sitting in my office and telling me all of this stuff that she has going on in her life. And she has no help with her child. But she said, but in all of that, I just have to do what I have to do. And when she left, I was like, you just have to do what you have to do, but you're broken.
And
you're broken. Like, I'm scared for you and your children when you get home.
The whole house broke.
Yeah, right. Because a broken person, it's hard for a broken person to raise an unbroken child. I mean, if I'm broken, right, and I'm rearing children, then some of my brokenness is going to rub off on them. I think one of you talked about that earlier. It's going to rub off, unfortunately. So we need to find resources. And schools, in all honesty, are the worst with this. Because in schools, when we talk about broken kids, broken children, many times in schools we try to do this one-size-fits-all kind of thing. Right. Okay? If a kid tears up the room and cusses everybody out, you're suspended. Go home.
Right. That's the quick fix.
That's not the answer.
Not the answer.
Really, it's really not the answer. It's a whole lot more than just go home for 3 days, come back to school, and
do it again.
Right.
Go ahead, Dr. Dane.
Or we're expecting these kids to come back and be fine.
Right.
And they're
not gonna
still
happen.
not fine.
Yeah, and I was just thinking that it's interesting the way you frame that because it seems like that really transcends a lot of groups too. One of the really interesting experiences I've had among many since I moved to Houston about 8 years ago was we had Sonia Sotomayor give a talk at, I think it was Jones Hall or something like that, and got to shake her hand when I mentioned the kind of work that I do with veterans and things like that. And I know she had a similar saying about being a strong Latina woman and everything. And, then I think also that it seems to apply to a lot of other groups as well. For example, my lovely fiance is from the Philippines, and I know when it comes to sometime in the Asian American community, it's been great to, be with her family. And I think of like her mother, who's just such a strong figure and always doing so much for the family and, never complains about anything and just, always kind of, taking care of. And I think that there's something about that caretaking role that's kind of a double-edged sword. It gives people such a tremendous purpose and, such value and meaning in life, but yet, also I'm sure, over time can, be challenging, especially to manage when, now all of a sudden it's not that I just have to, put food on the table and, make sure my kids are, getting their homework done and all that. But now all of a sudden they're having behavioral problems. What do I do with this and things like that? And I also wanted to follow up on, really, I always, it resonates with me so much when people talk about their personal stories. And I really appreciate you sharing what you shared, Dreux, that, to me, and other people might have a different kind of take on this, but, not only does, having some experience with some form of mental illness not define you as a person or really limit you, at least in the vast majority of cases, I would argue it actually may make you a more interesting person. And it might actually result in you thinking of things that other people may not think of. And I want to offer two areas of evidence of that. And it's definitely something I found as well in my own personal experience. But it's echoed in a book by Kay Redfield Jamison, who actually co-authored the textbook on manic depressive illness and bipolar disorder. She wrote a book called Touched by Fire that reviews all of these really well-known and productive artists, musicians, poets, painters, and so forth over the past few decades. People like Van Gogh, people like Hemingway, people like Schopenhauer, for example, and different composers and so forth. There's even a more recent book by a guy named John Gardner called The Hypomanic Edge. He did some research and found that often in the business world, when he looks at people who are, CEOs and so forth and gives them questionnaires about, mania and hypomania, their scores are through the roof. They tend to have that type of experience. So it's almost, and his argument is this, is that our entire country, the United States of America, was actually as it was founded, although if you look at other history books like The People's History of the United States by Howard Zinn, really good book, has a totally different take on who really discovered America and all this sort of thing. But one thing we do know about Columbus is, you have to really be thinking differently to think, what, they think the end of the world is out there, I'm going to prove you wrong. And to this whole notion of, so many people coming to the United States and thinking of, dreaming big and, wanting to have a new experience for their family and for generations to come, it almost requires a certain amount of a leap of faith, so that, and maybe that's one of many reasons why we face, certain challenges with mental illness that maybe in other areas they do not have. That we are, largely a country founded by immigrants that came here in search of a dream, and we have that in our bloodlines, and so maybe a lot of us are a little bit more, likely to have this sort of background and this sort of temperament. But I wanted to just conclude and with my section with talking a little bit about post-traumatic growth, and that when people do go through trauma, the vast majority will report over time that it wasn't that, this awful experience gave me these things. It was my struggle, my battle, the way that I responded to the trauma over time. And maybe it might have crippled them psychologically for the first few months. But over time, as they, really took a look at that experience and thought, well, what can I do with my life now? They'll say things like, I'm personally a stronger person. It's made some of my relationships closer. It's also changed the way I think about my spirituality or my philosophy of life. And a fifth area that hasn't been really echoed too much in the research or books on it by a couple of my mentors, but what I'm seeing in the suicide field as well as in a lot of communities, especially as we're responding to social justice matters, is advocacy. So I think one of the main areas that people might feel growth in is wanting to be an advocate for others, whether or not it's certain ethnic groups or you name it. Just wanting to find and really do things like you're doing right now. As a sign that I went through these experiences, it's changed my life, and I want to find a way to give back. I want to find a way to enhance my community and give other people a voice and give other people the tools that I may not have had at that time. And this is something that occurs over time, but also working with a clinician, in particular one kind of pretty well versed in trauma. Step one is usually engaging in some of those treatments that target the actual trauma and PTSD itself, but then over time, reflecting and thinking about the ways in which that struggle and that battle with trauma has resulted in certain changes in life that may actually be positive and may actually take people to a place in life that they otherwise would not have been able to get to. So just saying that the things we experience in life sometimes can be brutal and heartbreaking, yet over time there might be some types of benefits or new directions buried in that struggle.
So in your treatment or your response to the different ethnicity groups, is there a different plan that you present to them, or is it just like, okay, this is what you need to do to help overcome that issue?
Sure, it's usually pretty subtle. I would treat most people in a somewhat similar manner. I would usually give them the menu of options that, hey, we can approach your trauma in these ways. What do you think would work best for you? And then once we start to see a reduction in like those nightmares or, the thoughts about the trauma and other symptoms, hopefully then over time, and it may take months, it may take a year or two, or who knows how much time, just to continue to prompt them. So, you've really come a long way, and now that you have bounced back from everything you went through, you're back at work, or things are going well with your family, you're able to finally, your kids are doing well in school, no matter what it might be. What do you sense? Are there certain, I just really use a lot of the open-ended questions to really prompt them to think about, how their experiences changed them and things they would like to do to kind of honor the struggle that they've been through.
Dr. Daniel, thank you so much for your insight, for helping those with that particular issue. Thank you so much. And we'll have more information and contact information for our presenters. So if you guys that are watching would like to reach out to them, we will have that information available for you. No, there's no discount and all of that. We don't offer that. But we'll at least give you that information so you can have it and you can talk to them and work that out, on your own. But thank you so much, Dr. Daniel. Up next, we have Dr. Troy Moore. Dr. Troy Moore is one of the foundation, A Better Day Foundation's board members. He's also the education liaison for the foundation. And Dr. Troy is going to really talk to us on the really the real level, because he's the one that's dealing with the kids and the parents and all of that, as you heard earlier, that might be suffering from some type of a mental illness or a mental breakdown and all of that. So we just wanted to get some feedback from you, and just, if you can offer some advice and help to our viewers, then go for it. But we wanted to just kind of have that discussion with you and just learn more about what you as an educator deal with and what's the response to dealing with a student or parent or whatever that's suffering from a mental breakdown, mental illness, especially what happened here in the Houston area where a former student attacked and wounded a principal at his former school. Are schools really equipped to handle those things like that if a student is having that type of mental breakdown? So ladies and gentlemen, Dr. Troy Moore.
Can schools handle it when children, parents, whatever, are having a mental breakdown? My honest answer is no. We try. Many schools try. We have counselors in place. Some schools have social workers. I mean, we try. But in all honesty, the school setting is much different than the professional counseling setting or therapy setting because our focus is different. Your focus is solely fixing the problem, the mental problem. My focus is fixing the educational problem. I need to make sure that a kid can read when they leave school. I need to make sure that a kid can do algebra when they leave school. I need to make sure a kid can write when they leave school. So my focus is just a little bit different. But of course, because we're dealing with human beings, we get all of it. We always say, a lot of times in schools, we say, I talk to teachers about how parents send their best work, meaning their child, to school. We don't have a choice. So a kid can walk into a school and have all kinds of trauma, all kinds of mental issues, and we may never know until something happens. So no, we're not equipped to handle it. And one of the reasons that we're not equipped to handle it is because even with having guidance counselors in school, they're not just counselors. If you've ever been in a school, and everybody up here on this panel has, your high school counselor really didn't do a whole bunch of counseling.
Not at all.
Right.
Barely saw my counselor.
Yeah, right, exactly. So the high school counselor, they do schedule changes and they create the schedule for the student and that kind of thing.
So they're more of an advisor.
Right, exactly. And that's what I was getting ready to say. They're more of an advisor. But it's the same in middle school and it's the same in elementary school. It's like we have the title counselor, or many have the title counselor, but that's really not what they do. It's really up to the school district to make sure that things are in place. I remember in the mid-90s, I was a young teacher when Columbine happened. That was the first major school shooting that I remember. And when Columbine happened, it was like, oh my God, somebody walked into those people's school and just shot everybody up. Okay, and it was devastating. And schools became fearful. School districts became fearful. Okay, now we have something else we have to worry about. We have to worry about, how we're looking at security and how kids are just walking on campus with guns or how people have this open access. Because remember, school has always been a place where no one ever really worried until that time about security. All right, so more than the mental health aspect is really about security. And that's really what has happened. We've become afraid of the people that we serve. So now it's just all about protection in many instances. Okay, so on my particular campus, I'm also over safety, right? That's one of the areas that I'm over. So I have to make sure that teachers know what to do if we have an intruder drill, if we have someone that's a parent that's a threat, that's coming into the school or whatever, or a parent that's going off and cussing everybody out, or so we never really address the need. We only address the safety issue. We are just in the business of protecting us and the kids who don't have the issues, who don't have the mental issues, who don't have this trauma. So that's what kind of happens, and schools miss the opportunity a lot of times to help broken kids and broken parents because of that reason.
So do schools partner with the Dr. Angelas of the city and the Dr. Daniels of the city to outsource that particular student and parent or whatever?
Well, I'm going to tell you, it's gotten better. It's gotten better since the mid-90s. Now, when we look at it, we are trying to partner with people. Many times our counselors, they'll try to give parents a number that they could call. We have communities in schools and stuff like that, those programs that bring outside individuals into the school to help deal with trauma, counseling, Maslow's hierarchy of needs, like Dr. Jones talked about. We have those things, but it's still not enough. Because unfortunately, by the time they get to us, they're completely broken. And we're finding kids at a young age. Yesterday, on my campus, I was dealing with a third grader who I had to restrain because he was trying to run out of the building. And he was kicking, and he was fighting, and he was screaming and yelling and crying, and so obviously, now this is a kid that I had never seen before, never met before, but obviously there's something wrong. Because I think the bottom line was one kid teased him, and it triggered something in him. He wound up punching the kid in the face who teased him, and then he just lost it. So what do you do with that? How can a teacher who's been trained to teach math, science, whatever, deal with that kind of stuff?
Are parents required, should they be required to, list any type of mental illnesses that student has or has been diagnosed with?
It becomes a sticky situation because we have laws in place,
right,
of course, that protect kids. And we can't say you have to tell us whether your child has a mental illness. You have to tell us whether your child suffers from schizophrenia or whatever. We can't really do that. That's volunteer information that the parent would give. Now there are some instances where kids are in special ed, so we know about those cases. We know cases where kids have ADHD. We know cases where kids have autism and stuff like that. But in terms of mental health, that's not even something that we actually ask or deal with. Because, okay, think about it this way. If a mom comes in and says, okay, my son suffers from schizophrenia, what am I going to say? Because I'm not equipped to deal with it. I have absolutely nothing to say to this parent when she says that. I'm like, okay, is he on medication? That's the most I can ask, and that's if the parent volunteers the information. And what will happen is, especially when you work in poor minority schools, many of the parents are uneducated. They're not willing to share, because remember, we talked about earlier how what goes on in my house stays in my house, right? So I'm not going up to that school and tell those people that something is wrong with my child, or even something is wrong in my household. Maybe his brother is suffering from some mental illness, or grandmother, or whoever lives there. So he sees all of this and he's taking in all of this, and so it may affect him at school. If they don't volunteer that information, we do not have the right to ask those kind of questions.
But the school does have the authority to inform law enforcement that this student is having some type of mental episode. They may need to be taken to
definitely
a treatment center.
Yes.
Okay.
We do have the authority to do that. But in most cases, I will tell you, first line of contact in the school is the parent. Unless there's a major physical trauma happening. If a kid is having an asthma attack. I've had that before. I've had that happen before. A severe asthma attack, well, we just call 911, then we call the parent. If a kid has a seizure, I've had that before in the classroom. We just call 911 and then call the parent. So yes, we have the authority to act as a parent when needed. It's called in loco parentis, where you can act as the parent if needed. But in terms of mental illness and those things that they come with as broken kids, it's really not a lot we can do.
So what are the support services for the teachers? Not only the ones that have to deal with the broken child, but the ones that are broken themselves.
Right. Well, most districts now have EPAs because they've realized that teachers do come with brokenness and issues and stuff like that. And even dealing with children. We have a lot of educators who are very passionate about what they do. They're just not equipped to handle what they have to handle when they walk into a classroom. So it can be traumatizing. It can be traumatizing,
especially for a new teacher.
Yeah,
just out of
right.
school.
Well, but for any teacher, but definitely for younger, newer teachers, it can be traumatizing. So, we have health insurance plans that will offer a certain number of therapy sessions for teachers and principals as well. For school personnel. So they do have it. I don't know of a lot that use it. Because just like we talked about the I'm every woman kind of thing, and I'm empowered, I'm a woman, I got this. Many educators, the field of education is majority women. Absolutely. So they have a nurturing side to them. They have a sense that I can save these kids. If I just love on them, because their mom can't love on them, or if I can just buy them some stuff, get them some rewards when they do well. And so teaching is a heart issue. It really is. When you're in education, it's a heart issue. So most educators have the heart to do what they do, and they don't want to give up on anybody. I don't care, even if little Johnny just kicked the wall and threw, his backpack across the room and slapped somebody. Most educators still won't want to give up on little Johnny. The average educator won't. But they're not equipped to handle it. So yeah, I need to go to counseling because little Johnny just hit me with the backpack. You know what I mean? And I'm getting ready to lose my job because I almost lunged at little Johnny when I got hit because my own kids at home don't do that. You know what I'm saying? But I have to come to work and I have to take this kind of abuse, from a 13-year-old, from a 15-year-old, from an 8-year-old. So it's difficult. I always say that teachers need their own support group. They need their own therapy sessions just to sit and kind of swap stories and understanding that, number one, you're not in it by yourself. Number two, that, you can make it, and you have to have people to lean on. You just do. It's just that kind of profession.
While you was talking, I was thinking about when I was growing up, and then I grew up in the Catholic school, first of all. So I did pre-K through 8th grade in the Catholic school system. Then I switched to public school for my 9th grade year all the way through 12th grade. So, of course, it was a big switch there. But in the Catholic school, it's completely different.
Right.
We didn't have any episodes where the students wanted to fight the teacher and all of that. Not in those days. So it was never an issue. And, of course, the school was open. In the middle of the French quarters, you wouldn't imagine the school just being open to the public, right? But it was. But we never had any issues like that. But one thing that they did do was always bring in a Dr. Angela or Dr. Daniel to come and talk to us. There was this guy called Stan. Mr. Stan? Stan was the motivational speaker.
Yeah.
So Mr. Stan, and rest in peace, Mr. Stan. He passed away a few years ago. Mr. Stan would come in, talk to us. He would do all kind of mind games on us and all kind of stuff. But it just kind of encouraged us and let us know, okay, it's going to be all right. At the end of the session, we knew, okay, it's going to be all right. But I don't see that happening in school districts now. I don't see them requesting a forum to bring in a mental health specialist or a therapist to come do a general assembly to talk to the students. The only time you actually see it is post a traumatic situation, and by that time it's too late. And like they announced, that they would have counselors on standby for the students who needed to talk to someone because of what happened yesterday at Yes Prep. But I'm like, that's kind of too late at this point in time. Maybe if that had happened while this young man was in school at Yes Prep, he might not have done that yesterday. You understand? And it could have been much worse. But we think, we're thankful that it was just what it was. One teacher was wounded. But for the schools where you have the mass killings and the mass shootings and all of that, I often wonder, did those schools do anything to, eliminate this, to prohibit this? Do they only respond after the tragedy happens?
Unfortunately, many are reactive as opposed to proactive. And that's what we have to do a better job of in education. But of course, money is also an issue because when you're bringing people in, they want to get paid. In most instances, they want to get paid. And so budget becomes an issue. We have to find money in the budget in order to pay these outside entities to come in and help our kids.
But I would just imagine that the same money you use to spend for the counselors that you bring in after the school shooting, you can use that same money to bring in?
Well, usually those counselors are not outside entities. Those counselors are the guidance counselors in the school. Because remember, the guidance counselors, when they take their counseling courses, they do have to go through training for therapy sessions. And what do you do if a kid is depressed and that kind of thing. So they do have those kinds of classes, but it's just not the way the school system is set up is just not set up for them to actually do that job every day, all day. Although many kids need it. And we've touched on kids in lower income areas and minority kids, but a couple of years ago, I actually worked at a predominantly Caucasian middle school. Upper middle class, it was in an area where they had some plants. Most of the parents were engineers. A lot of them worked at the plants and stuff like that. And they're hurting just as much. They're just as broken.
Absolutely.
But it's just, but the scenario is different. They're broken because their parents don't pay attention. They're broken because mom just throws money at them and walk away, kind of thing. And so they're feeling neglected. They're feeling, looked over and that kind of thing. So it triggers something in them, but it's across the board. We have a society, a generation, I should say, a younger generation that's really hurting and broken. And so if I'm 15 and I'm feeling like I'm getting rejected by mom, right? Because she doesn't have time for me. And then I go to school and kids are teasing me, right? About the clothes that I wear. That's another form of rejection. And then I'm a little bit older. Now I'm in college. I made it out of high school and I'm in college. And now the woman of my dreams is saying, I don't want to have anything to do with you. No, I'm not interested in dating you. That's another form of rejection. So after a while, it's in your psyche that something is wrong with you, right? So then this 25-year-old comes back to the school, to the high school, and shoots the administrator. When really, because we didn't have anything in place a long time ago where we could have helped him, this is the result. And so now we have to be reactive and get some counselors in and say, hey, we have these counselors available for our students. And let me tell you, usually when that happens, because I've been in several schools where that has happened, where a kid like a student has died, a teacher or whatever has died, and they bring in counselors from all over the school district to help with this. After that usually lasts like maybe 2-3 days at the most, and that's done. It's over. Okay, stop crying, here's some tissue, go back to class.
And that's usually how it is. That's usually how it's been.
Right, yeah. It's not a real healing session. It's more like a sympathy session. I have sympathy for you. I'm so sorry that happened to your teacher. I'm so sorry that happened to your friend. And okay, now go
It's
back
my
to
lunchtime, I got to go.
Right, yeah. Go back to algebra.
Right.
So
it's a lobbying issue. And I don't know if the Federation of Teachers, if that's something that they've been lobbying for, is to get, the added funds to be able to bring in the therapists and the counselors and whatnot to do the general assemblies like we used to do back in the day. And my little school, my school was very small. We had 15, maybe 20 students in the class. Now it's 100 or something in the class now. So of course it's much more needed.
not quite 100, but
it feels like it. You see them posting, these kids posting on social media during class, so you can see it's about 40 people in one class. Nobody's learning. Everybody's on their phone. The teacher's on her computer. Nobody's really learning. But anyway, I'm saying it sounds like it's more of a lobbying thing where medical professionals, the teachers, the community has to all come together to go out and then lobby to Congress and to the government.
Right.
Listen, schools need extra funds so that they can start being more proactive instead of reactive for crisis.
And to be totally honest, I hear what you're saying, but just to put it out there, unfortunately, mental health is not at the top of a school's list. It's just not. What's at the top of a school's list is a test score. I'm just throwing it out there. Right. And I'm an educator, and I'm going to be very honest with you. Here in Texas, our kids take STAR. So that's our accountability system. And if too many kids fail our accountability system, then the school looks bad. So the priority is STAR. Is that fair? No, it's not fair. You can talk to just about any educator, including superintendents, principals, everybody, and they will tell you, no, it's not fair. But that's the
pretty
reality. Yeah, but that's the world, unfortunately, that we live in.
Because
Where
y'all will lose the funding, the little funding y'all already received.
exactly, yeah, it's really about will these kids be able to pass this test? Period. And anything else, any other kind of money you get for social emotional learning, for counseling or whatever, that's just lagniappe. That's just a little something extra. You know, and it's a very little extra. It's not. It's just not a priority.
Are schools allowed to ask the community for donations and stuff? Because I know that they're considered nonprofits, right?
Right. Of course you can. You can ask for donations, but the reality is, especially in poorer communities, it's hard to get.
True.
It's hard to get. You know, it's hard to get working parents just to come to a PTO meeting. You know, in many Title I schools, which are the lower income schools, they've pretty much cut out PTO and PTA because of that reason. It's like it was almost a waste of time. If we have parents that want to come in and volunteer, great, cool, awesome. And of course we welcome them. But in terms of having an organization like schools once had and that kind of thing, an official organization, they're very far and few in between, honestly. You know, only the more affluent schools really have a working PTA or a working PTO where parents will donate money, where parents will come in because they are licensed therapists. They'll come in and try to help the school and stuff like that. We just don't have we just don't have that available to us.
No, I can't say in my dealings with some of the school districts, I have seen that they have implemented certain groups within the school to help deal with mental illness.
Right.
So you'll have whatever the club is called. I don't want to misquote the club name, but I do see that they're offering clubs now to help students who are suffering from mental illness. I don't see it in a lot of the schools, and the schools that I have seen it in, of course, it's the larger schools in the district, HISD and Sci-Fair and all of that. So I mean, that's the start in my opinion. But if it can be offered throughout the district some way somehow, I think it would help more students. Or if you allow the students in the lower districts to come and share with the students in the other districts that where the program is offered, maybe we can do some good there as well. I mean, we got to start thinking outside the box. Right.
And a lot of times you're talking about clubs and groups that come together and that kind of thing. A lot of times that's student driven. Yeah. So if a student says, okay, I'm really depressed, my friends are depressed, can we start this club? And they go to the administration and the administration gives their stamp of approval, then that's how the clubs start. But the average high schooler is not going to do that. The average middle schooler is not going to do that. You know, they're not going to go to a principal and say, look, I need this club because I'm thinking about hurting myself. I need this club because I'm not sure of my sexuality. I need this club because I need to talk about, what's going on at home. The average kid is not going to do that because there's some hormonal issues there that they're dealing with. You know, as you grow, your hormones are out of whack, and so they don't know what to do with all of that they're feeling. So that's when I'm going to just get a gun and shoot everybody. I'm going to cuss the principal out, the teacher. I'm going to throw something across the room or whatever. That's when we have those issues.
Wow. So the answer is there is no answer.
I believe there is an answer, and I think you hit on it earlier. It's being proactive as opposed to reactive. But we need to find funding to do what we need to do to save children for real.
Right.
Not just save them in terms of graduating or save them to make sure they can read. It's a whole lot more than just that. That's a big part of it, but it's a whole lot more than that. Because if my mental capacity is not right,
you're no good.
Yeah, when I walk into a classroom, I'm not going to learn anything anyway.
The same advocating that a lot of celebrities do, like your Queen Latifahs and your Alicia Keys and your Bonos and all of that they do for music in schools. I think those that have that platform should do the same for mental illness programs as well, because that's really the root of everything.
Yeah.
You can't be a good musician or whatever, march in the band if you're thinking other things and you're just not mentally there.
Right.
So that's something, also try working on as well, to try to get those programs in schools, even if it has to come in from private funding. At least have something available so that the kids that are interested, they have somewhere to go and they don't have to keep suffering in silence. You know what I mean?
Right. And again, there are people there to help with it, but it's so many kids that need it until the help, like I'm thinking on my particular campus, we have a counselor, but we also have one outside entity that comes in to help with the mental issues that our kids have. So you have one person that's there, but you have 200 kids that need something. So how do you get to the point where every kid gets something and get it consistently? Because that's the key. The lady who's at our school who works in that area, she really works hard. She tries to hit every kid. But you all, as therapists sitting on this panel, know that if it's not consistent, it doesn't mean anything. Therapy and counseling has to be consistent in order to really make a change, to really make a difference in a person's life. Right. So if I talked to this kid last week and my schedule and my need is so heavy that I may not get to them again for 2 weeks, then what I talked to them about a couple of weeks ago is definitely gone. So it's like you're just kind of starting all over every time you talk to a particular kid. And that's why it's important, and I will say this, and I will be finished. That's why it's so important that every kid that walks into a school building has some adult they can trust. That's extremely important. Because if they have an adult that they feel like they can trust, they have someone to talk to. Absolutely. And going back to the guy who was 25 and shot up the school yesterday, he didn't have that. Going back to those kids in the 90s in Columbine, those two young men who went into school and they didn't have that. So many, the kids in Santa Fe, the kid in Santa Fe who shot up the school, he didn't have that. You know what I'm saying? So it's just really important that as educators, we understand our purpose, and it's not just to teach math and reading. It's extremely bigger than that.
That's good.
Yeah.
Yeah, I was looking at the news about the situation yesterday, and they interviewed his parents. I don't know if you all seen it or not. And I'm just thinking, okay, his parents, they're older in age, and I'm thinking they've probably missed the cue a few times. And this is why it turned out the way it did, for him doing what he did. So, and that's the case in most of the times. The parents are either, old and they just don't really understand and care, or they're young and they just don't know and they don't care. So it's you can't win for losing pretty much.
But even that, like, what parent doesn't miss the cue sometimes? Like, there's not a parent out there that doesn't miss the cue in mental health or educate. Like, as parents, I'm a parent, so you miss stuff. I mean,
you probably catch everything.
So no, I do not.
No, and look, and as good as a parent I think I am, I know I miss stuff.
You miss stuff.
Yeah.
And it's hard. So it's just like they probably missed the cue, but it's like they probably hit the cue on almost everything else, and they maybe, like you said, maybe they weren't equipped enough. They didn't know what to look for. He was 25. Was he even at home? Did they even have eyes on him? It's like, and like I was saying earlier, if he is diagnosed with a mental illness, who knows if he even suffered with mental illness when he was in their care. He could have just been diagnosed, just started to have, symptoms in his 20s. So as parents, I always feel sorry when I see these parents on the news, and it's like all parents miss the cue somewhere. Like, we miss something. Like, we're not perfect, So it's heart-wrenching for a parent to see that my kid did that. And of course, then you start questioning yourself, like, what did I miss? What did I do? Right. But as parents, we always miss the cue somewhere. And it's hard because you're trying to cover it all. But you know, we can't. We don't know everything.
No, I agree, and it's not to place blame on the parents for missing it or whatever. But usually in these type of situations, and you're saying that it could have been just missed, as he was growing up, and then it just exploded when he got into his 20s. I'm thinking at some point there may have been a sign somewhere.
Yeah.
You know what I mean? And then they just go, well, he's just a boy being a boy. He's just going through changes or whatnot, and it was really something more than. And that's something that we've talked about here, is making sure that we're paying attention, especially as parents, community members, whatever, paying attention, so that if you do see something, and you can say something. Let's talk.
Okay, so look at it this way, Drew. You said as a young man you were angry. You would pop off at the mouth. You would go off or whatever. Your mom probably would just correct you and say, I'm gonna punish you. You're gonna get a spanking or whatever. If you
we got beat.
Yeah, I didn't want to say that though.
I got beat.
I didn't want to say that. But what I'm saying is, whatever her discipline method was, that's what she knew to do.
Right.
So now here you are, a grown man, now diagnosed with this disorder. You see what I'm saying? So back then she had no idea. It was like, okay, I'm just being a parent. I'm going to whip his tail. And she did that.
Right.
As parents do when they're fed up, when they're angry, when they're upset.
Right.
They do what they do, thinking that that's going to change the behavior, not even understanding that it was so much more than that inside of you.
More. And that's what we're trying to do. We're trying to make parents, everyone, think outside of the box. Like, what is the root cause of them behaving this way? And then let's, deal with it that way versus, like you always saying, there is no one size fits all. Instead of just beating the child because he's talking back, maybe there's something else there. And we want people to realize that that's why it's important to go and get diagnosed, go get therapy, counseling, all of that. So if there is a bigger problem, you can address it, head on versus, finding out that so-and-so went and shot up a school or shot up somebody in the supermarket or whatever, because then it's just, it's too late at that point in time. But I think we kind of hit the nail on the head. I think you guys have covered a lot to offer as much information, insight as we can to allow people to, do what they need to do with that information. And again, we'll have all of the contact information for our presenters so that if you guys that are viewing want to reach out to them, discreetly or whatever, we'll make sure that we'll send that to you. And you don't have to worry about the information being shared or whatever, because we know that it's not an easy thing to ask for help. But we want to make it as easy as possible. And then if they're unable to help you or offer the particular help that you need, they may be able to partner you with another resource or give you other resources to help deal with that issue. So I want to thank our presenters, Dr. Angela Jones, Dr. Daniel DeBrew, Dr. Troy Moore, for being our special presenters today. We are so proud and honored to have you as partners for A Better Day Foundation, and we look forward to sharing with you guys soon in the future for many of our endeavors and efforts as we continue to help build our community. So again, A Better Day Foundation, you can reach us online, www.abetterdayfoundationusa.org. Again, www.abetterdayfoundationusa.org. You can contact us there securely, discreetly. You can also reach out to us on social media, which is linked to the website. And again, we will have all of the contact info for our presenters for you guys to go ahead and reach out to them. So again, the website, www.abetterdayfoundationusa.org, or you can call us at 833-747-2227. Again, that's 833 toll free, 833-747-2227. Thank you so much for viewing and being part of our audience. Again, reach out to us if you need help. We will gladly partner you with one of our resources. And we thank you again for joining us. Until next time, you guys take care of yourselves and be safe out there.